Folks, thanks for joining us today. My name is John Dubas with Premier Marketing. We'll be spending some time today discussing the Medicare Savings Programs, these assistance programs set up by the government to help people that fit certain parameters within the Medicare population that can make a huge difference as to their quality of life. It can also make a huge difference for us as agents, obviously, as being able to help our folks that qualify for these programs and garner referrals because of that situation. But it's also a way for us to make certain that we are able to see prospects throughout the year. Those who qualify for a Medicare Savings Program have that special election period for each of the first 3 quarters, in addition to what they may qualify for elsewhere. It's important for us to note this because, well, hey, we're going to run across these people all the time, very regularly, and it gives us an opportunity then to take advantage of the situation and improve the circumstance for both our prospects and ourselves and our agencies. You'll find that the software package that we're using today has a section for both questions and chat. We ask that you put your questions in the questions box. We do normally cover them through the course of the presentation, but I will make certain that we address any inquiries you may have in order to get you the maximum value of the time that you spend with us here today. Today's presentation is being recorded and will be made available through our website at premiersmi.com and on our YouTube channel as well. Additionally, your marketer with Premier Marketing, your agent success manager, will have access to all this information as well, and it will be made available to you in that fashion. So these programs do cover a lot of different program specifics in detail. So for some of this, it might feel a bit remedial for some agents. For others, it might be a perfect rehash or a perfect review, I should say, of the detail that's out there in order to make certain that what we're preaching is in effect the truth. For those of you that are unfamiliar with these programs, we'll make certain that we garner an impression for you of the quality differences that these programs can bring to your prospects and clients, and make a level set of their information that is being understood as well. So let's start with that about us. Premier Marketing is actually a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform, licensed in all 50 states, and work as an insurance wholesaler through independent insurance agents such as yourself, through contracts that are at the highest possible commission levels, with recruiting contracts available to those who qualify. We work through a full portfolio of products aimed at our target demographic. So those basic Medicare programs, the Medicare Advantage and Medicare Supplement plans, and the standalone Part D prescription drug programs are all available through our organization. But we also offer that full portfolio of products that include life insurance and annuity plans, final expense life insurance and pre-need programs, long and short-term care programs, disability income plans, and those ancillary benefits that address specific needs that our prospects and clients have. You look at the Medicare Advantage arena, all the national carriers are there with us through our organization, and many of the strong regionals as well, and that same philosophy carries over into the prescription drug programs. You'll find that these are generally offered as part of your MA contract, with a couple of exceptions. Mutual of Omaha is a separate contract than their other offerings, and Clever RX is a discount program and not a standalone Part D prescription drug program. When we look at Medicare supplement programs, we may not be looking at the same demographic that will be part and parcel of a Medicare Savings Plan recipient, but you don't know. And we want to make certain that we address the full spectrum of Medicare beneficiaries, and this gives us that opportunity to do so. We look to, once again, at those ancillary programs in each of these categories. The national carriers are there for you, for your use through our organization, and you can address these different specific needs. It also gives you the opportunity, in addition to taking care of that need, of, hey, growing your finances as well, because they are paid a commission, some of them pretty healthy, and it's a great way to create then another income stream for yourself and your agency. It's also an opportunity to use some of these programs for the marketing flexibility that they have. We don't have some of that same opportunity in the Medicare Advantage or Medicare prescription drug plans, or even with some of the med subs. So we want to make certain that we're using these in a fashion that address the need and helps us recruit, in a manner of speaking, prospect as well. When we look at the Medicare market overall, you see the aging of the baby boomers, the silver tsunami, 1 every 10 seconds, 10,000 plus a day. They're exponential in growth. But you're finding a number of folks that fall into some of these younger of the older categories where they're deferring accessing their full Medicare benefits for one reason or another. For those of us that are on the tail end of the baby boomer experience, we put it that way, well, we got to reach 67 to get full Medicare coverages, and by that I mean the money's coming out of our Social Security account, because we don't get full Social Security until 67 unless we enroll earlier and take less out of it. However, this number is mitigated by the fact that many people that are under the age of 65 are accessing benefits through Medicare because of disability, be it physical or mental. And these are prime candidates for the need for help of the programs that we speak to today. And look at that. That Medicare numbers, man, that's freaking huge. 65 million plus. And of that, a good portion of the folks are under, they qualify for DSNP in many circumstances. This gives us a wonderful opportunity to speak to a population that may have this qualification in play, but they don't really have it set up yet. So our knowledge of these programs can make a big difference as to how many people we get to help. We do so because they need our help. They have these different choices that come into play. They don't have to do anything with Medicare. You know that. They don't even have to take their Part B if they don't want to. Thankfully, most do, unless they have a darn good reason. Some will pick up a standalone Part D prescription drug plan to help with drug costs. Some will enroll in a Medicare supplement, that standardized, modernized Medicare supplement, that Medigap policy, and pick up a Part D plan as well for the prescription drugs, or bundle their benefits through Medicare Part C, where we see the biggest play with these programs that we speak to today, the Medicare Savings Programs. Those affect, in my mind, more commonly than anything other, the Medicare Advantage and the prescription drug plans. Some circumstances you'll run across how it works with a med sup, but we'll deal with that in just a second. We also want to make certain that people are understanding what we're talking about. So, an acronym guide taken from cms.gov, and we look at that and we go, gee, 4,420 of them. No wonder some of this is really confusing. Well, the government likes to define a whole bunch of things that are seemingly obvious, but there are a good portion of those in there that we got to look at, and we got to go, well, we want to make people understand the benefits for which they may qualify and how that can improve their current situation. And knowing the details as to what is what can make us that source of truth for the folks that we visit with. When we talk about the standard election periods, we're past all three right now, coming up on the annual election period once again, where people are going to start talking to you about certifications in just a couple of months again. But at present, these don't come into play for what we speak to today. These do. When we look at the different special election periods that are out there and that are available to the population we serve, a whole bunch of it deals with income and assets. And that's what we'll talk about today. And we'll see that there are other special election periods, even if a person doesn't qualify for a Medicare Savings Plan. Perhaps they do. The low income subsidy extra help program we reviewed last week. That's quoted on our website. But also the different programs that the individual might have an opportunity to use, re-examine their coverages. Because, well, gee, they may be in a state that has a special election period, but the majority of people aren't looking at their coverages year over year. And a good portion of what lends extra importance to this are these Medicare Savings Programs, which are reevaluated each and every year. So it is a matter of great importance for us to not only help people understand the possibilities that come with a Medicare savings plan, but how that can affect their overall change no matter what time of year it is, or what type of underlying coverage it is. Or, gee, have they even looked at some of the information the government puts out there to help explain such programs as Medicare savings programs? It's in the Medicare and You book as well. It's most certainly available on the downloadable app. And the government has a whole bunch of really nice presentations out there that people can utilize to, one, make certain you're telling them what you're supposed to be telling them, but two, for them to learn on their own or for whatever other reason, guide some of their friends and family to express, well, is this valid or not? We will see, however, the majority of folks aren't doing that. They aren't shopping. They're depending on getting information from people like us, either in person or sending them information virtually. If you have the systems in play that allow you to do that and do so compliantly, it's a whole different world, because then people don't have to search on their own. You're supplying that information to them, and they are becoming much more comfortable with receiving information in such a fashion because, hey, the world's taught us to be more digitally savvy over the last few years with this pandemic. You know, a lot of the folks, well, as we went to the doctors and the specialists, first part of the pandemic, all virtually for the most part. A lot of the prep work we did for hospitals and dentists were done virtually. Even our celebration of faith was done virtually. So we have a population that's much more comfortable with receiving information in such a fashion, but also gives us that opportunity to document, send things out on a fairly simple basis, and do so in a compliant fashion. We'll talk about that in just a second. So you've got some different pieces out there that want to give us the information that we have as to what Medicare savings programs actually are. The government has, once again, some pretty nice pieces out there, but folks aren't watching or listening to them. So we want to make certain that folks that are in the Medicare arena realize that, gee, a whole bunch of them will qualify for one of these Medicare special election periods. It's a question of which one and how that affects their overall circumstance. So let's look at what a basic Medicare savings program is. These are Medicaid administrative programs, and they help cover Medicare premiums and cost sharing for those with Medicare who have limited incomes and resources but don't qualify for full Medicaid. So they are folks at 100% of federal poverty level and above. These MSPs are known by different names in different states. So in your state, this may be referred to as a Medicare buy-in program, a Medicaid buy-in program, or a Medicare assistance program, or just might go by the acronyms that are assigned to them as a description of the services that they provide. So let's look at some of that. One of the first ones we run across are the infamous QMBs, the Qualified Medicare Beneficiary, the QMBs. These are folks that are in a program that was created by Congress back in '88. 62% of the eligible population is not enrolled in it still. So we've got well over half of it that qualify for this very beneficial program that aren't in it for one reason or another. A second level of assistance goes to the specified low-income Medicare beneficiaries, the SLIMBs, the SLMBs. These are folks that qualify for a program that was created by Congress back in 1990. And the vast majority of folks that are eligible for this aren't enrolled, 87% nearly. And then you have the QI ones, the qualified individual ones that are part of a group that was created by Congress under the Balanced Budget Act. The program's been funded by Congress through a block grant every year. Now it's fully funded by MACRA. The fourth category that some will allude to are for the disabled working. I don't spend a lot of time with that one simply because, one, we don't run across it all that often. So let's look at what a person has to have in order to be eligible for a Medicare savings program. Well, they got to have Medicare Part A. They've got to meet certain income and resource eligibility tests. And these eligibility guidelines are set by law, but states can raise or eliminate these tests. And for example, 8 of the states don't have a resource test. They've eliminated that test for all of the MSPs. So for those of you that work with people that come into your neck of woods and from these states, you got a different animal to deal with to get them a similar MSP program in your state simply because they've got to pass a resource test they haven't had to in the past. And that can make a difference. And generally, these applications are submitted through local Medicaid agencies, and they can start the application process for MSP by completing the low income subsidy application. You can, it's a good way to slow her down, but it can happen that way. Eligibility, as I mentioned earlier, is generally redetermined each year by law. We have a lot of talk going on now with some of the contraction of the Medicaid assistance in different states. So this can be a big difference here as well. There will be folks that perhaps qualified for Medicaid in the past, won't any longer, but will qualify for an MSP. So we want to make certain that we have our eyes open for the possibility of dealing with a few more people with Medicare savings programs than we have had in the past. These programs, however, do help eliminate the Part B late enrollment penalty at 10% per year that can be really costly for some folks, and any Part B penalty premiums waived for those who qualify for all of these categories that I mentioned, the QIMBs, the SLIMBs, and the QIs. This program is not like some of the things you see with Medicaid programs for nursing homes. States are not allowed to ask for repayment of the costs they covered under MSP from the estates of deceased MSP recipients. So a key difference there for some of you that may have worked before in the past with recovery of assets through a nursing home stay. And those eligible for MSPs automatically get the Part D low income subsidy Medicare assistance, that extra help on their drugs. They're deemed eligible. So they automatically get it with their overall system. And this is one of the things that you'll see that in certain categories, the help with the medications come with a level of assistance with an MSP. And that's a big thing that we need to put into our minds is the difference between that LIS and MSP. LIS deals with the medication programs, with the prescription drug programs. The Medicare Savings Programs borrow those LIS people, but they deal primarily with Medicare cost for medical attention. So the deductibles and coinsurance and the premiums that come in each of these categories. Looking at that specifically, well, there's a nice piece here from 2022. We have the 2023 one. Sorry, I missed that date as I was putting this together. But this gives you those numbers in a succinct fashion. So you have them all with you when you discuss things with the folks that you're visiting with. So it gives you that great detail about these plans and makes certain that you have the information at your fingertips as to go, gee, well, who does what with whom? This will help you entirely. It's also important to note that people who qualify for an MSP can do so. They can get that help or that Medicare Savings Plan, excluding one house and one car, regardless of the value of that house or car. So you'll see some people that have been living in a home that really needs some work. They got too much cash. They can put the money in the house and draw down against that cash with a category that allows that to happen. It's also important for us to note that in certain states, there are Medicare and Medicaid assistance programs, where these are a group or a program where Medicare and Medicaid are assimilated into a single package. It pulls it generally out of our prospect tool. It's in limited states, but you'll run across it, and it can create some questions for you. It's important to note, in addition to these types of programs, that you may also run across more and more frequently managed care in the Medicaid arena. As agents, we generally don't sell those either if they're not commissionable or available through our systems, but they do then create a source of confusion for certain people and are being able to explain the differences between the cards that they have can open discussion for a Medigap or a MA or a MSP in that household. That program in the state of Texas is referred to as Star Plus. It lays out different things by districts in this very large state of ours, and is based on where you live by county. it then gives us an opportunity to help people or make them be aware of, in any of these circumstances, why they qualify for these programs and why they're not in it. Generally, they might know both, but there are some folks that, hey, they never heard of a Medicare Savings Program, and so you can't enroll in something you don't know about. And then, of course, sometimes you'll look at an application for these assistances, and it will go, yo, that's a little bit of work, and I'll take a current pass on that. So you get people that will do it that fashion. There are also people that are aware of these programs and would like to get help, but they have transportation problems to getting them to a social worker, generally stationed in a Social Security office, to make it into the process. And then, of course, there are some folks that are still very proud people, and they feel that there's a social stigma for folks that are on these that puts them on a welfare program. So you've got a number of things that are in play that may or may not be the source of prohibiting your prospect from getting into these programs. So how do you help people qualify for an MSP? Well, there's a number of different things that you can do. You can send that person to the Social Security office, as I mentioned, set up an appointment with them for help with the social worker there. You can make use of the My Advocate program through United Healthcare or similar programs through one of your other Medicare Advantage carriers. And then, of course, there is the NCOA benefits checkup program that can help make people aware of and enroll them into these different systems. Part of the challenge that you have in these areas that is different from this last one, where you can be proactive and assist the person in process themselves, when you lose control of that individual. And one of the things you're looking to do is obviously improve that person's situation, but you want to make certain that they are there for you then when it comes time to, well, in addition to this, we can make available to you now the special needs programs that you qualify for. So some things that you want to be conscious of, and how much time you want to invest of yourself into this situation. The more you do, the easier it is. But those first couple will take some time if you're going to be proactive and assist in that process. It is important to note, though, that once a person has a Medicare Savings Program, well, they may well qualify for that dual special needs program. And that individual's got to have Part A entitlement, Part B enrollment at the minimum. They got to qualify for one of these assistance programs. You have then an additional requirement that you are making available to these folks so they are eligible for that DSNP. So they got the A and the B, and they qualify for these assistance programs that we've just discussed. And they live in a service area where the program is offered. And unlike a regular MAPD program, which did kind of away with the got to worry about end-stage renal, well, in certain circumstances and certain DSNP programs, end-stage renal can be a kicker. So something to be aware of. As I mentioned before, these programs are eligible for a quarterly special election period. Each of the carriers that I've run across so far and their producer help desk, the agent assistance programs they have, really make it simple to dial in and find out, well, gee, they are eligible. This is the level of assistance. No one has utilized that SEP. Let's give her a go. It's also a circumstance where you can dial in. They'll say, well, that person already made use of that SEP. You can't do anything until next quarter. So things that can come into mind there as to how, once that person has a Medicare savings program, that we can help them with additional insurance coverages as well. I mentioned a little bit about how people get along with an MSP and a Medigap policy, a Medicare Supplement policy. Since Quimbies pay all out-of-pocket A and B costs, Quimbies should not be an individual that has sold a Medigap policy. Against the law, get you in deep crap. We don't want that. There is a 2-year suspension for Medigap if a person qualifies for QMB, where the beneficiary can then cease paying the Medigap premiums, go back and get a policy within 2 years. That may be for folks that have lost income during a certain time period and they qualify their help now and hadn't in the past, or for whatever reason. It is a way to pause a Med-Sup plan if they're on it. Now, something to consider, because then if you have a Quimby, You don't really want to be doing that for a person who has a med sup. But if the person has a med sup and they qualify for a SlimB or a QI, well, that's only paying that Part B premium. And so that person is still responsible for the medical cost of their Medicare benefits. And this can be a great fit for those folks because it's paying that Part B premium. It gives additional dollars for those people to take out a med sup if that's what they want to do. Obviously, we want to review all of their options, but that is an option for folks with a Medigap policy in those circumstances. Now, there are MSP programs for people getting long-term care Medicaid. We want to make certain that that is handled properly, and those are specific circumstances that vary from state to state. And we want to make certain that we handle it properly, regardless if the person is getting assistance at home or at a residential facility. So we want to make certain that in special circumstances, we do that extra homework and get those folks the detail they need as to how this can affect them, because it's different from state to state, or can be. You do have a number of different resources here to fry the brain and addle the eyeballs here, but some things that you can go into that can give you additional information so you can feel better about your knowledge base of these different programs. And this is a great topic to use either virtually through a webinar or in reality through a seminar at those different centers of influence, speaking to Medicare Savings Programs. This is a program that gives you the details that you need. So it's a presentation taken from the National Council on Aging. This says October 22nd. I haven't updated one for 2023, but it then gives you the opportunity to identify yourself and roll through a presentation as to what these programs are. So this is a good way for us to feel comfortable with the programs themselves. It walks us through talking points. It also then gives us the opportunity for us to go back into and review our own knowledge. Because here, boy, this is the QDWI that I skipped over in our regular presentation, right? So something to consider there. So this presentation is available to you as well through your marketer, or give me a buzz, drop me a line, and I'll make certain that you get it as well. So it gives you then detail about these programs that you can speak to with the folks that are important to you in your career, in a manner of speaking. Prospects, giving them the detail as to what makes you different. Well, part of it is your knowledge base and the way that you are looking to get every piece of information to qualify our folks for every piece of assistance that they have coming. So we can do so through those programs. It gives us then the opportunity to make certain that we are positively influencing everyone we meet. And it's a great way to come up with different referrals. Part of why you want to do that through us here at Premier, what does give you the opportunity, we do, of creating an electronic profile within the systems we have with SureLC, Insurance Bay, whatever you want to call it. It's a great way for you to put in all your information and contract with carriers electronically. There are certain Medicare Advantage and prescription drug plans where we'll send you a direct link to the carrier, but this is an opportunity for you to have that profile in there. And if you want to add on multiple ancillary programs or carriers within other parts of the insurance world, it's a great way to start the process very quickly, cleanly, and hey, they don't have to translate our handwriting. We do offer discounted E&O for qualified agents. What makes you a qualified agent? Well, you got a contract with us. Why do we need E&O? Well, all the insurance plans here recently that I can determine are requiring errors and omissions coverage from you, for the policies you offer through their organization. This program is one where you're purchasing that coverage, and it is your benefit package. It is your system that you've purchased. So even though you're working with Premier for this product, you might be working for a marketing organization XYZ with a different product. This can be used in either circumstance. Premier is huge. We offer programs all across the country. We don't offer everything everywhere, I'm certain. I don't know of anybody that does. but this gives you that opportunity to utilize a program you own to fulfill the requirement the insurance companies have for you to have in order to offer their programs. We do also offer discounted continuing education programs through our association with WebCE, a good way to keep your license in play. You can add to your own benefit package as well through a modified guarantee issue non-cancelable DI policy, disability income program for yourselves on which you're paid a commission. A great way to guard your own ability to earn monies. I mentioned as we started that today's presentation is being recorded, will be made available on our website on premiersmi.com because of some different compliance pieces that are coming about. This may be put behind the wall and will be made available there for you, all 24/7. There is also a current posting of all of these on our page on YouTube, on our YouTube program. This is a great way for you to go back, digest what Medicare savings programs are and how they can affect other people that engage with your book of business throughout the process. So how do you work with doctors? Well, we got a program in there on how to work with providers. How do you work with faith-based organizations that reach people that other marketing systems don't? Oh, there's a system in there for that as well. It's a great way for you to also determine, once I got that Medicare savings program in play, is there a dual SNP in this market? Well, there's a program in there that speaks to generically dual special needs programs and how you can determine where they are and if you have them in your market. So a great way for you to utilize not only the recording of today's presentation, but past recordings as well to help make this very successful for you. We do also offer, and I cannot undervalue this system that is made available to our agents without cost, and it is our Medicare Center program, where you have an opportunity to quote multiple carriers compliantly, side by side, through a singular login for 3 different quoting engines, and do so in a fashion that allows you to record and obtain the scope of appointment that's necessary for some of the programs. Any of the outbound sales calls that you need to record, that's available here too as well. Not only the recording of them, but the storage for that 10-year period, much like what you have for that scope of appointment. It also makes use of a CRM for you, a client database that you can utilize to deal with folks, not only in the enrollment process initially, but then throughout the years, plural. That gives you the opportunity to go back and visit with them about other programs as well. And the system actually gives you help as to who you need to talk to first, because there are different hashtags that will go through and speak to people that perhaps are more likely to change than some of the others. And that is laid out for you there too. It does also give you a personal URL for your use. So a presence on the World Wide Web with programs that you decide that are part of this program, this system, that's made available to you. Lead Center we'll talk about in just a moment, as we will about learning center resources, even though that's basically detail as to how we can get better at our skill set. So different talking points for dialing out, different talking points for presentation of a certain program. And keep in mind, all of this is available on a mobile application as well, and is available, to paraphrase J.J. Walker on some of those bloody commercials we deal with so often, it's free. There's no cost to an agent associated with our program, contracted with our organization for this program. Some of the things that are made available to us in marketing to folks, now not in the Medicare Advantage or Medicare Supplement arena, which pretty much does away with some of the stuff we're talking about with the MSP, unless we go into ancillary programs that may have carrier incentives that are extra dollars that you get from that carrier for selling so much in a particular month. Those incentives may help you qualify for carrier trips as well, and even some of the premier incentive programs that we offer. We had a producer convention that was back this last week. Yeah, it was last week. I'm down to Mexico, where many folks enjoyed that as a piece of full earnings for their hard work. We do help you as well with different lead programs. There are contact lists for folks that are still smilers and dialers. A little hard to do sometimes, but it is made available to you with low or no cost, butted up against the do not call list. And then, as I mentioned before, when we talked about the recording of different pieces that we have, well, these are some of those systems that can make that work for you. Taking the information from today with the Medicare Savings Programs and putting them in play. It also gives you, of course, if you're working with certain Medicare Advantage carriers on a regular basis, an opportunity to glean leads from them as well. They have them upon occasion, and we want to make certain we do it compliantly. But by establishing that relationship, we can create a lead flow from a carrier to us because of our work with that organization. There are also internet leads available through social media. We'll talk about a couple of systems we have, a direct mail support program, T65 Locator, and a referrals system. When we talk about direct mail, that piece is a discounted program based on production that is handled for 2 different opportunities each month, one for health programs and one for final expense plans. So if you've been busy and productive throughout the month, you may qualify for 2,000 pieces of mail help as opposed to a singular one. By driving down the cost and giving us the opportunity to do this on a consistent basis, it gives us then that opportunity to do it consistently, as I mentioned, consistently, because then it's like exercising. You exercise once or twice every 2 weeks, whatever. All you're doing is feeling a little pain. You kind of go, well, I did exercise, kind of. It's the same way with direct mail. You do it consistently. You're establishing a reputation in a particular area. You are making certain that people are aware of who you are and what you do. And mail consistently, your lead response will pick up. And since the companies we work with have been vetted, we know what their systems look like. They're going to turn those leads back to you as quickly as possible and do so through different pieces of correspondence they've kicked out on your behalf that have been vetted by us as well. So it's all going out compliantly. We want to make certain that it works and works consistently for you. You do also have access to other direct mail response from one of our partners. It dials in Medicare leads based on area, time of year, type of product, that sort of thing. But it gives you an opportunity to buy just a single response or multiple responses. However you want to put it in play. It's a great way to reach people who've raised their hands for information on certain programs and have not received it through this request. Those internet leads we spoke of, they are Facebook programs. We have this one through a vendor that has a system for both final expense and for Medicare. One of the things that I want to caution people on about social media leads is you can get a really, really quick response, and they expect a really, really quick response from you. My friend, she got a lead at 1 when she called them back at 6, 1 in the morning to 6 in the morning. Called them back at 6, they've already gone someplace else. So if you're going to invest in Facebook leads or internet leads at all, make certain you have a system in play to handle them as quickly as possible when they come in, be it in that systems format or through this additional vendor we're using that drives responses through search engine optimization. We want to make certain that you have the opportunity to access internet leads without having to create the beast all over again. Lead Center. It's part of the Medicare Center. It's also a system where multiple lead vendors have set up different pieces of outreach to help us create leads in certain areas to drive activity and production hand in hand with you. You can do so in 2 different ways. You can have a direct hot transfer where it's all on the phone, flip it over to you, or the information goes into your CRM and you handle it as quickly as possible that way. Either way, you are determining the amount of leads that come to you, sometimes based on just how many you can do in a day, sometimes based on that's all I can afford, whatever it happens to be. It gives you the power to control this lead system and put it in, hey, I only want 3 a day. I only want 10 a week, whatever it happens to be. And I want them of this type. There are sales in these leads as frequently too. So we want to make certain that you utilize this as a lead source moving forward as well. We do make available that T65 Locator, where you download a system onto your smart device, whatever that happens to be. You register, they find out, hey, you got a contract with us. You have access to this program without additional cost. And you can create different listings of people in different areas based on the demographics that you supply the system. So let's say you stacked leads in a particular market, one bailed on you. What do you do for that hour? Well, you can do community contacts, reach out to them as well, or you can also put in some data in here, look at some 64-year-olds, go knocky on their door for dental programs. One of the things you see with dental programs is many times the premium takes a jump from 64 to 65, a great way for you to pursue that business and fill your funnel, your sales funnel for T65s moving forward as well. That referral program, well, it's a system that reminds us to speak to people through the course of our presentation, asking for other people you can help. May not be so bloody blunt in that fashion, but it's a great way for you to take one lead, cast it upon the waters, and all of a sudden you got multiples. Hey, I appreciate you setting an appointment with us here today. I look forward to visiting with you. Do you know of others that you trust that can be in on the appointment as well that may need the information? Boom, you got referrals before it even starts. It can be a system where you're calling your current book of business and telling them, hey, I've got a new dental program that rolled into our area. It can be a big difference for a lot of people. Do you know of folks in your neighborhood that need help with dental expenses? Click, click, click. Well, I do. Well, great. Let's set up a time to visit about this. Or if you're doing it all virtually, let me get you the detail out there to do this. Or here's a microsite for one of my carrier partners, Emeritus, that gives you a way of shopping different programs yourself. Let me send you that link. Different things you can do to engage your book of business, be it someone you sold or not. We do all this because we want your business. We want to be referable to you and your friends. And having the detail about Medicare Savings Programs, it's a question of study, not a question so much of I got to have additional certification in order to make this work. You don't have to have every number in your head. You got to have the reference material with you, however, and you got to be prepared to speak to this to everybody because you never know. And if you aren't speaking to them, it's the old, oh, if you're not going to do it, someone else is going to do it. Not meaning to be spiteful. There are people out there that do ask this each and every time. And some folks that you may speak to that, well, like, they surprise the heck out of you because I didn't think they'd qualify for that. Well, did you ask? Put it as part of your personal marketing program. Put it in play. Don't procrastinate, and let's get her rolling. I ask you to watch your email box for additional information coming to you through your agent success manager with Premier. Also, watch for follow-up that the company does in their newsletter as well. So as I see people who are on today's program that have worked with us in the past, I want to thank you for that business. I look forward to the opportunity to enrich that relationship. It may well be through our work in special needs programs or with folks that are entitled to Medicare Savings Program. For those of you that are just on this to check us out, thanks. Appreciate that. Hopefully we can earn your business in the very near future. But for everyone who's come on today, you've invested time with us, your most precious resource. And we surely do appreciate that. And until we're able to speak with you all again in the very near future, we wish you good selling. Thanks so much.